Hello, I'm Dr. Hamamji, and we're here today to talk about a new development in gallbladder surgery. Historically, as you well know, gallbladder surgery was done through a big incision just under the rib cage that required 2 or 3 days in the hospital, followed about 3 or 4 weeks to recover from it. In the early 90s, we moved from the big incision towards laparoscopic surgery to do gallbladders. And that involved a small incision by the belly button through which a camera is placed, and 3 cuts under the rib cage where we put instruments and we would do the procedure. In order to do laparoscopic surgery, we use what we call triangulation, meaning the camera comes from one part that is far away, and then the instruments come from other parts that are distant and separate from each other in order to allow for traction, for moving the tissues, and specifically the gallbladder. And that is how laparoscopic surgery was done. As we moved on with newer instrumentation, with the quest of getting into lesser invasive surgeries, a few years ago we started doing laparoscopic surgeries through one incision, through the belly button. That was fine, except in order to do that, we had to deal with the triangulation problem. And since we didn't have the trocars or the instruments separately placed, we had to use curved instruments in order to achieve the same result. But that meant that the surgeon who was using the curved instrument has his hands crossed, and he was working backwards and frontwards trying to achieve the same view of the field where he was working in. And that was very difficult to do, and adoption of the technique was not very great, and not too many surgeons learned to do the procedure. Recently, the FDA approved a new device that can be used with the Da Vinci robot in order to do the same type of surgery through the single incision. We call that the single site robotic assisted procedure. This is the actual port. We call them port. These are the access sites that we use to put the instruments through. It is made of silicone, it's very flexible. It goes through a less than an inch incision that goes in the middle of the belly button deep inside, and that will never show once it's healed. As you can see, these trocars are crossing, and then the instruments from the right side comes out on the left side, and the instrument from the left side comes out on the right side. So if I were to control these instruments, my hands would be crossing, or my brain would be wondering which hand I'm using in order to control which instruments. Obviously, I can get used to it. But having the robot do the flip, then we don't even have to worry about that, and we don't have to keep thinking which hand we're going to use in order to control which instrument. Obviously, the advantages of using the robot are that you have better precision, you have better visualization with a 3D camera view. Once the instruments are removed, the opening in the belly button is closed in layers, and then within a week or 10 days, maybe sometimes 2 weeks, the incision is all healed. You can't even see it. It's sitting deep inside the belly button. Recovery is about a week or 2 at most, and then there you go. It's like you never had any operation done on you. At St. Joseph Hospital, we were the first hospital in Orange County to adopt this technique and to introduce it into the community. And so far, all our patients have been very pleased having the surgery in this manner. If you'd like to have more information about this procedure, you can call us at St. Joseph Hospital, and we'll be more than happy to give you any information you may want. Thank you for listening and watching our video.